And here we are. Dr. Pantaleno, can you hear me?
Yes.
All right, we're going to try this again. I know my good friend Nellie is with us and Pam is with us, assuming you haven't signed off when I said we're going to come back. But here we are. And once again, Dr. Anthony Pantaleno is an award-winning clinical psychologist. He recently retired as a school psychologist where he affected the lives of hundreds, if not thousands, of young people. He has spent his life making life better for others. And he's had a private practice of psychology for quite a while out on Long Island. It's called Pantaleno Psychological Services. And his most important credential, he has been my very, very close friend for more than 47 years. And you can take a guess as to how old we are. But Tony Pantaleno's experience in this field is only exceeded by his compassion and his ability to listen to others. Tony, welcome back. Let's see if we can't get these
Hi.
right.
Okay.
All right. So tell us. It looks like we're coming up.
Hey,
Oops. That's not good. There we go. I have two computers running at the same time here. So, Tony, tell us a little bit about your background and philosophy on treating your patients, your clients, those you care for.
Well, my original training back in the 70s was with a brilliant psychologist who anyone who studied psychology would know. His name was Albert Ellis. And Albert Ellis's contribution to the field in the 60s, 70s, and beyond was cognitive behavior therapy. So that is a primary tool which I use. Cognitive behavior therapy teaches that how you think about events in your life will largely determine how you respond to them emotionally, how you respond to them behaviorally. But the second wing of my philosophy is really the incorporation of mindfulness-based techniques. Mindfulness being a form of meditation that helps us to work with thoughts and feelings and emotions in somewhat of a different way, but to basically look at them and allow them to be as they are without changing anything. Very different approach to the same idea.
It is different, but at the same time, it is classic. And in fact, we in dentistry, as a dental patient, if I can digress for just a second, sometimes a dentist doesn't see a problem the same way that the patient does. And if they can't connect, if a dentist can't see a problem through a patient's lenses, their mental lenses, there's a disconnect. And that's often why dental treatment or any treatment becomes misunderstood, because the practitioner and the person receiving the services don't see it literally eye to eye. Their brains are not in sync.
Absolutely.
So go ahead, Tony, please.
Lesson number one, listen to your patient for a bit before you bestow your wisdom and strategies and techniques.
Yeah, I have a very important dental technique that I've talked about, and it's called SuWay L, shut up and listen. It seems that the less I talk, which is kind of hard for me, and all of my patients and the people who know me know about that, but I do discipline myself to be quiet and really try to absorb what everybody else is trying to tell me before I give what I and all my brilliance know is the answer. But sometimes my brilliant answers aren't right for other people. And so it goes with what we're doing here with COVID. I think you hit the nail on the head by saying the situation is there, but how we are approaching it really, really dictates how healthy we're going to be through a crisis like this. Is that right?
Absolutely. So if you look at it from the cognitive perspective of we're all going to die, well, that certainly leads you to fear and other emotions. If you look at it from the perspective of nothing can happen to me, you go out and party on the beach with your friends and it's just a normal day. But if you're a healthy person, you take reasonable precautions. If you have to go out, you wear gloves, you wear an N95 mask as opposed to the $1.99 mask. and you do things that are sensible and reasonable.
Yeah. By the way, those of you who are watching this live, I can see if you pop in a question. So if you want to type in a question, just put your name next to it, so your first name, so I know who you are. And if you have questions for Dr. Pantaleno, we can answer them here. So type in a question and I'll see it. Tony, it seems that every time the news comes on and we've been, especially last week, we were riveted to it. And every time an announcement came on, I got a feeling in my belly and it translated right up into my throat and it hijacked my brain. And for a while there, I was paralyzed. No, I'm not the only one. Tell us what goes on when that happens.
Well, that paralyzed feeling is part of what you learned in 10th grade biology, the freeze, fight, flight, freeze syndrome.
Mm-hmm.
So where did it come from? Why did you react like that? So primitive human beings, primitive man, as the brain developed, you've heard the phrase reptilian brain.
Yep.
Your reptilian brain in prehistoric times took care of you and made sure you stayed alive. That's what its primary function was.
Mm-hmm.
So it evolved. You evolved, and on top of that reptilian brain was built your cortex and all the complex functions that came with that. But the reptilian brain, again, to jump back into our 10th grade biology, central nervous system, peripheral nervous system, autonomic nervous system. If you subdivide the autonomic nervous system, there are two branches, the parasympathetic branch
Mm-hmm.
and the sympathetic branch. The sympathetic branch is what turned on that response. That response has to do with energizing you when you are facing an imminent threat.
Yes.
Know all the physiological responses that come with that. Your heart rate speeds up, etc., ready
Mm-hmm.
to take on that stressor. The problem in this crisis and the problem in our modern life is that that activates for many, many people in the presence of essentially really non-threats.
Mm-hmm.
So if you're walking down the street and let's say when you were a child, you were bitten by a dog. Now you're an adult. You're walking down the street. You see a dog across the street on a leash being walked by its owner. Your sympathetic nervous system turns on.
Yep.
So you cannot stop that process. It is not under your control. So if you're an individual with a very, very light touch on your sympathetic nervous system to light it up, many things will do that. A crisis like this, particularly for those people who are glued to their TV, will essentially have your sympathetic nervous system running on overdrive. So there's our stress.
Yeah. And when we are stressed like that, my understanding of it, certainly as a dentist and as a person, is that it kind of takes control, and we only think in terms of saving ourselves from what is right in front of us, with no future focus at all on how to think our way through a situation that is not almost literally a moment at the moment life and death. By the way, my Fran, my wife, is listening here, and I guess she's hearing it. Hi, Fran. Hi, upstairs.
Hey, Fran.
um, so how can we become cognitive of the fact that every time the news tells us X more coronavirus cases, or the stock market plunged or rose, we can't overreact to either one of those things. But how can we make people aware that this happens, and what happens next after we recognize this, after we understand now from what we heard, what comes next? Talk about desensitization.
Well, I would never want to minimize that any of these events going on are not real. Obviously, they are. So whether you're impacted by having to be fully quarantined for health issues,
Mhm.
or you may be dealing with financial crisis, those are real. So I never would
Yeah,
want to maintain, it's a no big deal kind of a thing. That's ridiculous, of
correct.
course. But subdivide your life into two areas. What is under your control and what is not under your control?
Hmm.
What is not under your control is completely not anything that you can respond to by action that you may take. So the last headline I read was that President Trump could impose a 4-week quarantine on New York. If that happens, what can I do about that? I can go out, but I'm sure there will be police cars circulating to make sure I go back in. But I can't do anything about that except respond to it and try and respond to it in an intelligent way. Many people have stocked up in the event of that type of a situation, but that I can do something about. I can still go to the store with my mask and my gloves and purchase supplies I might need for a couple of weeks. But the element you're talking about, the desensitization, constantly hearing these horrific predictions over and over and over and over again essentially wears you down completely because you cannot live with your sympathetic nervous system on 24 hours a day. It just does.
Hmm.
You become exhausted, and that's the end of the story.
Yeah.
Or you become exhausted and your emotional status plummets into a very deep depression or into a very frightening level of anxiety that makes it impossible for you to do the things that you can do.
Yep. Some of the things that first of all, I have limited my TV news watching to twice a day. I just that when I hear X number of deaths here in New Jersey, X number of new cases, hospitals overrun, I accept and understand the fact that it's going to get me in my innards for a short while.
Mm-hmm.
I am very alert and I understand that I've got to turn that off and ask myself, what in the world can I do about it? Well, I've donated a batch of my personal protective equipment to the police department. I've offered to donate it to the state of New Jersey when they ask.
Mm-hmm.
I do things like this. You're the first in a series of health and wellness things for my patients. And we have done another program for another community I'm involved in. And I can sit with my wife and with my son who are with me and enjoy their company.
Mm-hmm.
What else can I do?
Well,
That's a rhetorical question. What can other people do? I'm sorry.
well, let me give you the introduction that I would give to anyone who wanted to learn a little bit about mindfulness meditation and how it may help them during this crisis. Can I do that?
Please, yeah, this is, we talked about this privately, and mindfulness meditation started decades ago. And I think you can tell this better than I can. The people who started this were really out of the box, out in left field, and viewed that way. Go tell us a little history of that first.
Well, the history of that in the United States is very recent. It really only came into the United States in the early 1980s. So it's an infant in terms of how long it's been around. The history of meditation and mindfulness goes back 2,500 years or so to Buddhism. So when people hear that, they get a little bit frightened, they get kind of
Yeah,
turned off. But the people who brought it into the United States, the psychologists who brought it into the United States, understood that. They understood that you don't walk into New York or Chicago or Newark or LA and talk about Buddhism because you're not going to get too far unless you're a Buddhist. Um, but
makes
what
sense, Tony.
what they did is they retained the scientific elements of mindfulness, and there are thousands of peer-reviewed studies which support its use in various medical conditions, anxiety, depression, and that's the version that came into the United States. But if I wanted to give you and your viewers the simplest idea of where we start with this discussion. Oh, let me get my.
See, I centered that out a little bit there, Tony.
Zoom it out. All right. Now you can
Past,
see it, right?
present, and future.
Okay, past, present, future.
Mm-hmm. Yep.
Pre-COVID, a typical day in the office. Somebody comes in. We'll just call it with stress. We won't elaborate. The source of much of their stress is on things that have already happened. They can't do anything about those things. Sorry, I'm playing with this here.
Yeah, you
Can't do anything about those things. The other source of their stress is often what's coming down the road, the future, the unknown, what's going to happen. In this situation, there are endless questions about what's going to happen. So the past and the present, the future in this graphic are written in this way because that's really how it is. In the middle, the present. We don't spend too much time in the present moment. So if you eat your breakfast, you're probably on a typical day pre-COVID, eating it quickly to get out of the house, to get into your car, to go about your day. You may not even taste your breakfast. You may not even know you had breakfast. There are days I can remember in my whole life where I've had 2 or 3 slices of pizza for lunch, and 2 hours later, ask myself, did I eat lunch today?
Oh my goodness!
Oh. That was also pre gluten-free diet. So now it's gluten-free pizza.
Well, I'll tell you right now, Tony, this coffee is pretty darn good.
Good. You enjoy it.
I'm loving it while I'm listening to you.
So now, let's take you to a slightly different graphic.
There you go. Yes.
So now we still have the past, the present, and the future. And the very simplest idea in mindfulness is the notion that if we intentionally can use our senses, all of our senses, not just our thinking, all of our sensory apparatus, to come into the present moment. It's what people would mean when they would say something like, wake up and smell the coffee. What's going on? What's actually in your day, in your moment? Stop and smell the roses. These are phrases that have been around since the beginning of time. Those are good, quick ways to remember what mindfulness is really about. It's about teaching people to take some time, and you can do this in a formal way with formal meditation practices, or you can do it just by what you did. Sipping your coffee, closing your eyes for a couple of seconds, tasting that coffee, and doing nothing else. It's called focused attention. So anytime you're doing something, you've heard the phrase in the zone. Anytime your attention is highly focused on a particular activity, you are being mindful at that moment. Everything else drops off your screen, and whether it's sipping your coffee, looking at a sunset, taking a walk and looking at the trees, taking a shower, brushing your teeth, these are all informal practices where if you focus on the sensory experience of that, what happens is your normal thought process slides over here. Pre-COVID on a normal day, here's your normal thought process. If it's a logical, sensible thought process, you're a healthy person. If your normal thought process is a catastrophic thought process, this is how you walk around all day. Your thinking dominates. So in mindfulness, what you're doing is you're sliding your cognitive processes, rational processes, irrational processes over here. So they're still there.
Mm-hmm.
We cannot get rid of them. We don't want to get rid of them because they're part of who we are. But if they're slid over here, and my present moment can now be on a very simple activity and my attention focused, what happens is your emotions start to soften. They don't have that rigid edge anymore. and you can perhaps be in a little more peaceful place for even just a few moments. Sorry about the long answer.
No, that's awesome. My friend Pam, who lives locally, you wouldn't understand this, but Tony, she says you would have remembered if it was Vic's Pizza, which is a very local brand of thin crust pizza that's out of this world. And I too, like you, have you've totally phased it out for reasons we don't want to get into, just personally. For much similar reasons, for my health, for my gut health, I phased that out too. So Pam, I'm now you got me craving what I can't have, and you've sent me into this irrational spiral. Tony, I need to focus here on this discussion. Just tangential to what you're saying, would focusing on deep work, let's say people who are very, very heavily involved in thinking or research, or really into getting a task done for work, to the exclusion of all else, does that count for some mindfulness?
It does from the point of view that they are focused on something very specific. Obviously, if their children are crying in the next room, or their teenagers stealing their car, that's not going to be mindfully helpful to them. But like everything else, everything is relative. So nobody could live a mindful life 4 hours a day. Impossible.
Yeah.
There's too much stimulation.
Mm-hmm.
But the idea is, if you take a few moments during the types of normal activities you do, to actually just stop the clock, look around, whatever that activity is, walking your dog, and just focus on walking your dog. Like one of our teachers, when you're eating, just eat. When you're reading, just read.
Mm-hmm.
Focus on that one activity. And you can then, if you're interested, learn more formal practices where you set aside a period of time each day and you do a formal practice. And what the research shows is that if you spend about 15 to 20 minutes a day doing a formal mindfulness practice, you actually alter the structure of your brain, which I could not have believed when I first was being taught that 15 years ago, 10 years ago. But I believe it now because it's what the research shows. It desensitizes the amygdala itself. You light up less frequently. Your stress response is modulated. There's a pause. When you're practicing a formal mindfulness activity, there's a pause. And researchers are trying to determine now is, and the thinking is, after about 8 weeks of formal, your brain has now understood what that pause is. When you're first practicing, your brain has no recognition of it. It actually tries to blow it away. When you're doing it on a daily basis, like going to the gym, when you used to go to the gym, your brain's to understand it. It's a pause. So the carryover into real life is that stress presents itself to you. Your normal response would be very, very reactive, instantaneous. Build in the pause. The same stressor comes at you. Someone in your family is diagnosed with COVID. Your finances take a significant plummet. Your normal reaction, you know what that would look like. Build in that pause, and what happens is you're still going to have to respond to that situation. It didn't go away, it didn't disappear. But when you build in the pause, your response to that is going to be more thoughtful, more sensitive, and less emotionally reactive.
Mm-hmm. Before we get into, Dr. Pantaleno is going to treat us to a little demonstration of this. But Pam asks, what about multitasking? Something that I am guilty of doing, and I'm trying to get under control here as my other computer goes on fire and my phone's going on fire, and I am bombarded with stuff daily. But what happens when we're at our desks or at our workplace or at home and we're multitasking? I suppose that's the antithesis of what you're talking about.
You answered your own question. Exactly.
Yeah.
So in grad school, we were all taught to multitask. If you could multitask, you arrived. You are a god on earth.
Fake news.
Multitask mind.
Mm-hmm. Tony, your internet is freezing
So
up.
your attention cannot be focused on one thing,
Yep. Mm-hmm.
which is mindfulness,
Mm-hmm.
when it's focused on 7 things. Polar opposite.
Very good.
Not bad. Not bad if you're in a work mode and you're attempting to do a number of things. No one's saying multitasking is bad. Of course not. But if we don't punctuate that and learn to punctuate that, our stress level becomes so chronic that you then come to see people like me because you can't cope anymore.
And not only are there implications for your psychological well-being, but as we'll get into further into our series, there are serious implications for your cardiac and other your body's, your physiologic well-being with this constant bombardment of cortisol and emotionally activating hormones and chemicals that are in your body when your fight or flight goes off the wall, gets overloaded its circuitry. And,
Absolutely.
and I kind of hinted this daggone thing doesn't help a whole lot either, because we're just constant. And I've got to find a way to get this phone out of my way when I'm trying to do something or when I'm trying to just de-stress. I just got to put it away sometime.
You could send it into your local lake, but that would probably your patients probably would not appreciate that. So the interesting thing is that Google, one of the largest corporations in our country, because they are so cutting edge with so many things, they're also cutting edge with mindfulness. They give their 52,000, that number's probably higher, it's from a couple of years ago, let's say 55,000 employees, lessons in mindfulness for free on a daily basis.
Wow.
Why would a corporation the size of Google do that? It answers itself. If they can have employees that are less stressed by all of the rest of life, it frees up those people's creative energies. And those are the people that created the iPhone. Interestingly, the guy who created the iPad spoke in New York last year. And he said, we had no idea when we created these devices how they would transform the entire culture. So now we also spend millions. I forgot the gentleman's name. He created the iPad. He said we now spend tens of millions of dollars in teaching people how to put it down. And one of his suggestions was a no digital Sunday. So you take one day a week, pick your day, and no one in the family uses devices, obviously, unless they're on call or they're in a medical situation where they must keep it on. But all other calls, all other tugs on your attention are not responded to that one day.
That's you struck a chord in me because in the Jewish faith, the Sabbath is a time where even long before there was a cell phone, the Sabbath was a time when you engaged nothing outside of your family and your faith community. Very traditional Jewish people will not use anything electric. And our rabbi, a dear friend and a dear mentor, and I'm going to be talking to him as well in my community, and maybe we'll get some faith-based stuff here too. But he says you need the Sabbath. All rabbis have said you need a Sabbath once a week, just to get away from it all and focus on what's important. And I want to. We're running long here, but that's fine. We're doing good stuff. But I really think that one of the beneficial if there's some good to be derived from this horror that's gripping the world right now, I think we're going to realize more and more what's really important. And
Yes.
the people that I take care of, I love them, and I miss all of you terribly. Tony, you and I have been friends in a group of people, about 6 or 7 of us, for 47 years, and we got together online, and it was so meaningful. And my family, that's important. Everything else is just kind of fluff, and we're coming to realize that, aren't we? So, Tony.
Well, the Beatles are important. Let's not get carried away here.
So are the New York Yankees.
Come on
Tony,
now.
well, I like both. Anyway, why don't you, Dr. Pantaleno has now reached a point where he's not only, I don't know what the correct phrase is, he's pretty darn good at mindfulness. He and I have spoken personally about it, and will do so even more. But Tony Pantaleno teaches that, and he has been gracious enough to give us a little bit of a demonstration of mindfulness. So, Dr. Tony Pantaleno, take it away. Teach us something.
Okay. So when we teach a mindfulness class, I teach a 4-session mindfulness class. The beginning conversation is always why people came in, and it's going to be various stress-related reasons. But we talk about what happens, what people notice when they slow down their breathing, and what happens to that stress when they engage in some type of a practice like meditation or yoga or those types of things that center us. So the reasons that people really understand why they're doing this is it's not just some touchy-feely thing from the 60s. The benefits of mindfulness is it increases the oxygen level to the body, making us more alert. It decreases our heart rate and our blood pressure, something very important to me who's on blood pressure medications. It slows our breathing. And the most important aspect of a mindfulness practice is it turns on the parasympathetic nervous system. We spoke about the fight flight response and the stress, the feeling that occurs when our sympathetic nervous system is engaged. But meditation practice turns on the parasympathetic nervous system, which is that soothing, calming part of your nervous system. So there's no on for the sympathetic nervous system. When it turns on, it's on. So you have to let it run its course and eventually it can come back to baseline again. But in teaching medicine, what we want people to understand is if they're practicing just a little bit every day, they're actually strengthening their parasympathetic muscle. So the effect of doing that is an incredible lifelong skill that enables that part of the nervous system to dominate and the less reactive sympathetic nervous system rather to dominate. Mm-hmm. So what I'm going to ask people to do for this exercise is I'll just kind of try and sit back in your chair, stretch your legs. I'm going to ask you to close your eyes if it feels comfortable for you. And stretch back, get nice and comfortable. I'm going to ask you to put one hand on your chest and one hand on your belly. I want you to just breathe normally for a few minutes. I want you to notice whether the hand on your chest or the hand on your belly moves more as you breathe. I'm going to give you a minute to do that. Just your regular breathing cycle.
Far and away my belly.
Okay. So if your chest hand moves more, that's just indicating you're a natural natural chest breather. Most people are, and that's fine. Just means it may take you a bit more practice to figure out how to breathe with your belly. So now I want you to place both hands on your belly, and let's work on starting to breathe more with our bellies. So as you breathe in, push your belly out as best as you can so that your hands rise up. Let your hands sink back down as you breathe out. Might help to imagine a balloon being blown up in your belly as you breathe in. And feel your head riding up and down as you breathe. And take nice deep breaths this time so you'll actually feel the movement of your hands and your belly rising. If you're not used to breathing with your belly, you may feel like you're struggling a little bit first. So you can breathe normally for a few minutes if that's more comfortable, and then go back to your belly breathing. Remember, this is a new skill, and it really does take practice to learn. You learn this over many, many days and weeks of practice. They just want you to focus on a deep breath in, nose, expand the belly, breathe out through your mouth like you're blowing out candles, and push all air out so you feel your hands recessing into your belly. I'm going to give you time to take 3 or 4 of those breaths. Now, here's the most interesting part. As you're breathing, your mind will likely wander because that's just basically what our minds do. They take us to a million places. When you notice your mind has wandered, just simply bring your attention back to the feel of the hands on your belly, riding up and down with the breath. This time I want you to take 5 or 6 breaths, slow it down even more, and deepen your breath by counting maybe up to 4 or 5 silently. 5 on the exhale, 5 on the inhale. And if this was a class and I had my little bell, I would ring the bell just to bring this to a close. But you can just open your eyes when you're ready and come back into the room. And if we had some time, we would go around and talk about what people's experiences might have been. Some people may say, I can't do that. I can't slow my breathing down. Some people may say it may have made them feel more anxious. In other words, in a typical class of 12 or 15 people, you're going to get a tremendous diversity of responses. And what the teacher is going to do is validate and normalize all of them because there's no one right response. It's a practice. So just like learning to ride your bike, it's going to take you a while. You'll stumble a bit. You'll get a little further. You'll stumble a bit. But after you've been riding your bike for a while, you no longer think about the steps that you're using or driving a car or doing any task. So the reason for the daily practice and belly breathing is the all-time Amazon top recommended meditation practice. It is the practice that, and it is the practice that we start with. So if you did a belly breathing for 5 or 10 minutes in the morning, 5 or 10 minutes in the evening, 8 weeks, you will see an effect. I will send you a link where you can download the app that we use in the class for free. It's got about 12 or 15 audio guided tracks, including this one. It's called Koru Mindfulness, and the app can be accessible. The creators down at Duke University made the app accessible for anyone who wants to download it. Actually, excuse me, I think it's not free. It is I correct that. It's $3.99. It's a one-time download. But if you email me and you want it, I will add you to my personal list of individuals, and I'll give you the app for free.
That's wonderful. You saw me doing this myself, and I found it very difficult to focus. As you said, and I've tried this before, my mind goes all over the place. So as you were encouraging me, I was centering myself back on the movement of my hands and the counting of the depth, the timing and the depth of the breath. I felt a momentary relaxation of the tightness that I naturally have in my neck that I'm working on. And when we stopped, when you told us we're done, I felt this momentary feeling of serenity, just a very deep but brief moment of inner tranquility, where all of the stresses, even the focus of what we are doing together right now, it all went away. And I felt very comfortable, very at peace. It was amazing.
So let me just make one other really important point before you wind this down. The goal of mindfulness is really not relaxation. If that is your experience, of course, that is wonderful. But I never want teachers who teach this, never want their students to think they're going to learn this so they can now live in bliss and harmony with the world and feel no pain, feel no suffering. The goal is really to help people be with whatever their experience is. And sometimes that experience is deeply painful. And we don't do that for a bit in teaching people how to work with those states. This is the beginning. These are the training wheels that help people sit in times of sorrow, in times of anger, in times of enormous anxiety, to sit and be with those emotions and to allow them their space. That is the ultimate goal in learning to be with whatever our life is, including the good parts.
Yeah.
That's important.
And that integrates very well with your rational philosophy also.
Correct. They go together. They're two
more.
wings. They're the two best wings in mental health that I know.
So my friend Gina wants the app, and our friend Pam, who would like to poison you with Vic's Pizza, was calming.
As long as it's gluten-free, I'm in.
There you go. So Tony, give us your email address so that our friends can contact you. You could also contact me, and I can connect you with Dr. Pantaleno. We have been friends for a long time, and Tony is one of the most giving, sharing, decent people that I have ever met. And I'm going to take this class with you, and I'm going to try to ask Fran to join it with me. I think that this is awesome. So we're not selling anything, not pushing anything. This is just making you aware of something that's out there that can help you deal with this nightmare that we're going through right now internationally. And also, after this passes, Tony, you and I both know there will be something else as we get into the new normal. Something else is going to stress us.
Absolutely.
So
So
Tony,
if
how
your
do we
viewers,
get in touch with you?
your viewers email me, and what I will do when I receive their email is I will send them a link. When they click on that link, they will have the Koru Mindfulness app. It will be for free. I hope you don't have 10,000 viewers yet.
Yeah, that's right.
But anyone else who wants to do it on their own, I will send you the link that they can download it as a one-time download for $3.99. My email address is Dr. Pantaleno, D-R-P like Peter, A-N like Nancy, T-A-L-E-N-O. So it's Dr. Pantaleno, P-A-N-T-A-L-E-N-O at gmail.com.
You couldn't have had a simpler name to spell, Tony. I remember
At least it's not hyphenated.
What's that? At least not hyphenated. Yeah.
I said at least it's not hyphenated.
A stern is a lot easier to remember. So I would encourage you to email Dr. Pantaleno. You will find him to be an incredible resource and an incredibly giving, caring human being who really knows how to listen. Tony and I, over the decades, have had some very profound discussions for our mutual benefit. And I'll also tell you, we've done back in college some very profound shenanigans, which were to nobody's benefit. But we were young and playful and goofy back in those days. And Tony, what you have grown into is absolutely remarkable. Your friendship to me is a treasure. And I just look forward to talking with you at any time, for any reason. All of our followers, if you're out there, please invite your friends to like our Facebook page. This recording will be on there. And we're also creating a YouTube channel for this and future recordings. I intend to go forward, especially while we're down, but as long as I'm in this field, I will bring you health tips, wellness tips, dental, and otherwise to make life a little bit better for you. This has been so much fun, and I think people will benefit from all this. So please, please, please watch your emails. My patients, watch this Facebook page and bring your friends. More is coming. Tony Pantaleno, I love you, buddy. Thank you so much.
Peace.
Stay with me here. I'm just going to end the stream. See you guys. You have a great day. Okay. Live healthy. Make somebody's life a little bit better today. Thanks.